implant malposition and the correction of that. And this is one of the most common procedures we do at Hillcrest Plastic Surgery. There are a lot of breast implants placed, and many times over time, the patients find out that one, when they lay on their backs, the implant falls out under the armpit. Two, the breasts are too close, almost joining in the middle, or the breast has fallen down on the abdominal wall or rides too high up on the chest. Let me describe each of those in more detail. Lateral malposition often comes from a forceful muscle push, which each time you exercise or you exert yourself, pushes the implant over and under the armpit. Well, how do we fix that? We close off the capsule, oftentimes using a more narrow implant, bringing the implant back up on the chest wall, plus or minus a breast lift. Now let's talk about inferior malposition. That's where the implant falls out on the chest wall and slips down on the abdomen. And that comes from loss of the natural fold, which is called the inframammary fold. Well, how do we fix that? We tighten up the capsule, close off the space, restore the inframammary fold by tacking it to the rib cage. In the case of a high-riding implant, where the implant sits high on the chest wall, completely covered by muscle with a hard capsule, we release the capsule, closing off the space from above, releasing the muscle below, and allowing the implant to fall into a very natural, almost teardrop shape. Medial malposition, or what's called symmastia, or what the patients often call uniboob, is where the implants are so close together that they almost touch. Well, how do you fix that? We either take an implant that sits behind the breast and place it behind the muscle, or we can repair the capsule, shifting the implants more lateral. Each of these requires a specific and different technique, and I would urge you to see someone who does this frequently.